My name's Rachel Burr, physiotherapist. Welcome to Loughborough University Sports Medicine Clinic. Today we're going to be talking about ankle sprains, very common sports injuries, and we're going to run through the basic assessment and management. So what is an ankle sprain? A ligament is a piece of tissue that connects bone to bone, and with a ligament sprain what happens is that the ligament gets overstretched beyond its normal range of movement. So this can occur in sport for many reasons, often landing awkwardly from a jump, or potentially another player could be involved. For example, in football, a tackle coming in from the inside could cause the foot to go into an abnormal range of movement. Okay. With an ankle ligament injury, the mechanism of injury is often that the ankle has been forced into plantar flexion and or inversion, which will stretch and break some of the fibres in this ligament. Now, depending on the severity of injury, that will affect how long it takes to get better. A grade 1 injury, where it's just a little stretch of the ligament, may recover in a few days and you'll be back to sport, within a week. A more severe injury, where you split some of the fibres, you break some of that ligament, you get a lot of swelling, bruising, bleeding into the joint, you may be looking at more like weeks to months of rehab before you get back to sport. And a complete rupture, where the ligament is completely broken and possibly even pulled off some of the bone, you can be looking at months and possibly even time in a cast or surgery. So it really is important to understand the severity of the injury, because that will guide the rehabilitation process. So we're going to assess the active range of movement, which is where we look at the range available. So if you pull up your feet, Jane, towards you as far as you can, comparing right and left, and then point the feet down towards the floor. Okay, good. And then up and out, so, and then down and in. Okay. So then we look at passive range of movement, where we'd add on a little bit of pressure to the active range. So if you pull up as far as you can, Jane. Any problem with that? And then point down, and then a little bit of pressure here. Okay. So we just need to get an idea of the athlete's weight-bearing ability to bring the knee over the toe without compensation. Within a ligament injury, you may find that there's some restriction, which would obviously be something that would need to be worked on. So if we just check by getting the athlete with the heels down on the floor, trying to maintain as good a foot position as possible. Jade is actually a little bit overpronated or flat-footed, so we're just going to guide her to try and keep legs in as good alignment as possible. So Jade, if you just come forward, knees over toe, heels down as far as you can. So I'm looking for, do the knees come forward a similar amount? Is there any pain one side compared to the other? And then back into standing. I can measure that a little bit more objectively against the wall with a tape measure, but just as a quick screen, that's fine. If obviously there is a restriction in the joint, that would be something that we need to do as an exercise. So we would do knee over toe exercises, like off the step or in standing. Okay, so the first 72 hours post an acute soft tissue injury, you would apply the prior regimen, which Joe's already done a video on, so refer back to that for the acute management. We're then looking at restoring range of movement, which is just simple range of movement exercises. So in a non-weight bearing position, moving the feet through the range of movement as we did in the test procedures. So up and down, and then out and in. So you can just do these movements while at school or work, just regularly moving the ankle to get some mobility there. Start strengthening the ligament, but in the first few days you're not going into pain, just starting to gently mobilise into the area. Once the swelling and initial symptoms have started to settle down, then you need to start applying some strengthening. Okay, so we're going to use the TheraBand to provide some resistance and strengthen up the muscles around the ankle. So you can use the band and point down against the resistance, or up to the side. This is really important one to do. I would generally do some extra reps on this one to strengthen the peroneal muscle down the side. We will then want to start moving into more weight-bearing functional exercises. Things like simple heel raises, both legs together to start with. that way you're giving the injured side a little bit of help. Once that's completely pain-free, you can take it onto a single leg heel raise, and bending one leg up behind, and just slowly. Now it might be that to start with you just do a smaller range of movement. As you get more comfortable, you can go higher and increase the reps. Balance work is also really important. After a ligament sprain, the tissue doesn't give you as much sensory feedback, so you need to do lots of balance exercises, or proprioceptive exercises as we call them, which basically improve your awareness of where your body is in space. So initially, just simple things like standing on one leg. And if that's easy, you can take it into closing the eyes. Again, that's good. And just increase the proprioceptive challenge as the ankle improves by making the surface slightly unstable. So that might be as simple as folding the pillow up in half and standing up in that. Or you can try something like an Airex pad or wobble cushion. Just increase the balance challenge. Okay, to summarise management of an ankle injury. Once the acute phase is over and the swelling and bruising is resolved, we're looking to regain full range of movement, strength and proprioception. End stage rehab needs to include lots of balance work and sport-specific progressions. Of course, if the injury isn't resolving quickly and you've got any concerns about the diagnosis or management, come into the clinic and we can give you some more specific advice. Thank you for watching. There'll be more videos to come, so look out for those. This is Rachel Burr from Loughborough University Sports Medicine Clinic.